So let's talk some truth about cellulite today. First of all, I'm not telling any of you something you don't know, which is creams cannot fix cellulite. Whatever the advertisers say, it just can't. And there's a structural reason why. So I want to explain that today. So number one, cellulite is caused by these fibrous bands underneath the skin and through the fat that actually pull the skin down. And that's why it's causing this puckering of the fat, because these bands are all underneath and they're pulling it down, and you see these little bumps all over the place. That's what causes what we call dimple cellulite, the dreaded dimple cellulite. And unfortunately for us women, estrogen actually increases these bands by multifold compared to men. And for men who do have some of these bands, the bands are in a different sort of horizontal layout, so they're not pulling down, and that's why most men do not have any cellulite. Now, in terms of surface versus underneath, this is also why, like in certain lighting, your cellulite might look okay, and then other ones it looks worse. That's because sort of the angle that you're at, so the dimple may show up more. It's also why, in terms of where it comes from, what the structures involved, even the thinnest women, the models walking down the runway will tell you that they have cellulite in areas too. So even though you might have a thin fat layer as compared to somebody else, like a model who's weighs 100 pounds, she still has fat there and she still has those bands. So, a lot of people say, whoa, I've exercised, I've lost all this weight. The cellulite can sometimes even look worse when there's not much fat there to kind of push it up in that way. Another thing I hear about a lot of times, and I like to dispel the myth on, is people are like, well, I work out every day. I've been building all this muscle. And that is fabulous. That's great for your health. That's great for your, overall metabolism. But muscle, remember, is underneath the subcutaneous fat in the skin. So even though you could have the best muscle structure in the world, you're still going to have that fat layer with those fibrous bands causing that dimple cellulite. And now we have a belly. And I know a lot of you are incredulous. Oh God, here we go. Another cellulite treatment that is going to end up not working. Well, remember, in the past, a lot of these treatments were based upon that surface of the skin. And we want to address those fibrous bands that I talked about. So belly is a treatment where we're actually going in under local anesthesia, of course, and we're releasing those bands. And it's amazing, I'm telling you, as somebody who treats patients, to see those dimples just kind of pop up. It's amazing. And it really comes back to why you're getting this dimple cellulite in the first place. So this treatment really is going to the cause of this dimple type of cellulite, which is amazing. So at Nichols MD, when you come in for a consultation about cellulite, we really take a comprehensive approach and examination of you, because a lot of times what people have is not dimple cellulite. A lot of times it's just that skin laxity, you know what I'm talking about, on the sides of the thighs or the back of the thighs. And that's just loose skin, from loss of collagen, from aging, maybe also from rapid weight loss, of course, that we're seeing a lot with the GLP-1s. So that's why it's so important to come for a good consultation with us so we can evaluate whether you are a candidate for something like a belly to treat dimple type of cellulite. So remember, when we're talking about cellulite, remember the structure of those fibrous bands that we're talking about, skin versus, that underneath structure that's causing it. Also, why creams don't work, or maybe why surface treatments like lasers and even microneedling, can improve the texture of the skin but can't do anything for the dimple cellulite. And also, of course, precise evaluation of patients, because there might be areas where you have the dimple cellulite that's amenable to something like a belly. And there's also areas where you might have skin laxity, where it's amenable to other things that help the skin, like Gretted Secret and other, type of more surface treatments. So if you're curious as to whether you have cellulite or what type of cellulite you have, that dimple versus just, that skin laxity, looseness of skin, then come in for a consultation. We'll take a really good look at your anatomy, and we'll come up with a treatment plan that will give you natural, effective results.